Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com, and our producer is about to
break a leg.
Break a leg.
That was for you.
Wires.
No, that was for you. Good luck. Break a leg. That's what we do in this business.
Anyway, we have last week I mentioned that I'd be talking about alternative approaches to cover natural medicine treatment, right? And so today, that's what I'm going to talk about. And I'm going to talk about a couple of programs that have emerged that my practice is involved in. And that's probably a new announcement to most people. So my practice, A Path to Wellness, in Northeast St. Pete, is going to be getting more involved in alternative coverage, alternative natural medicine coverage. And that means that we're going to be part of a couple of networks that are specific to or inclusive of natural medicine. Now, that doesn't mean that we're going to not be covered by others or that people can't, use their insurance, because what we do is we provide a super bill to our patients with codes, both diagnostic codes and procedural codes, that can be used to submit to their insurance. And all they have to do is call up member services, give them the codes, say they're filing a claim, give them the codes, they'll punch it in and, see what happens. Now, obviously, the conventional plans tend to have more issues with coverage of natural medicine. And this is one of the reasons that these kinds of programs are necessary in our environment, in our culture, I suppose. And so addressing that area of coverage, there are a couple of companies that we're involved in and with. And one is out of Massachusetts, and the other one is out of Hawaii. The one out of Massachusetts, we're involved in as a provider, and it is, I'd say, even more specific to natural medicine than the other one out of Hawaii. However, the one out of Hawaii is already promoted as being approved for the ACA, or Affordable Care Act, in other words, Obamacare. So in other words, that program, when you're involved in that, you should have coverage as far as tax credit for Obamacare. The other program I'm not so sure about yet, but I will be talking to the owner or the owners of, and the people that started up the company next week from Massachusetts. So we'll be talking to them in person. And the other lady I've spoken to from Hawaii, we're going to try and set that up as well. Possibly next week as well, or possibly another week. So it's something that a lot of us have been really, really wanting to see happen, and it's starting to, we're at the very, very beginning of that process with these two companies. And one of the companies is, is basically an alliance, or a cooperative alliance that includes natural medicine. Okay, so the natural medicine is provided obviously by a licensed practitioner. That's one of the main criteria, and that is true for both of them. That's true for both the Hawaii company and the Massachusetts company. Okay, so that's some protection built in. I'm ecstatic that these things are starting to happen. I've found myself struggling with conventional insurance companies, or our practice struggling with them in terms of, dealing with the issues that they throw up. They put up blocks. Their whole job is to avoid covering people, basically to take their money and then not cover them as much as possible to make the biggest profit. And that's been well documented and shown in, like the movie by Michael Moore. What was it? Sicko. They talked about the insurance company game, which is take your money and do everything they can to deny your claim. And this is one of the reasons they have huge, huge profits. Well, the coverage that I'm talking about now has a greater focus on natural approaches, holistic medicine, natural medicine, functional medicine, orthomolecular medicine, oriental medicine, naturopathic medicine, etc. The whole range. And including chiropractic as well. So this is a great benefit to those who, like myself, don't look for treatment through conventional medicine, at least for the most part, right? And there are a lot of reasons for that. And I'll go ahead and kind of discuss some of those areas and reasons. I'll give you an example. With my practice, here's something for you. We have been discussing in the office some of the things that we do very well or best. I'll put it that way. We have gone back and reviewed all the patients within the last year that came to us for treatment of infertility. And we are at or near 100% on turning those couples into parents. These are people who have had a lot of difficulty conceiving, may have physiological issues getting in the way of their conceiving, whether it be the guy having a low sperm count or no sperm count even, or problems with the structure of the sperm or the function of the sperm, like motility, moving forward in a directed path, as opposed to even moving forward but around in a circle, these kinds of things. So that's one aspect of it. And then the female may have hormonal issues, imbalance issues, maybe too high on one hormone, too low on another hormone, or the same hormone, that kind of thing. And we work with these issues. And so what I'm saying is that every couple that has come to us or close to it, I may not have caught every file or every couple that's seen us, but we're close to, at least close to 100% success. The success rate of IVF is less than 1 in 5, less than 20%. Here we're doing everything naturally at about maybe a tenth of the cost, certainly a fraction of the cost, and very, very successful at helping people become pregnant. And coming to that realization was really a mind blower. I mean, it's an amazing thing. And so one of the statements in one of the kind of brochures that comes with one of these companies I'm talking about is that natural treatment cost is less and certainly no more than conventional for a given diagnosed issue. So that's interesting because that's obviously what we're seeing with our approach. Another area that we've had great success in is dealing with an issue that, you know, to some may be surface, and that is primarily with, most of it is young females, somewhere in the range of early teens to mid-30s usually. Acne. Acne is a big issue for young women, and it has to do with their hormonal balance or lack thereof. And because, you know, there's a lot of background there, I'm pretty experienced at that. I can help women with the underlying cause of the acne, and I can help the guys too, but it tends to be the women that have the issue more so. And we're very successful at that as well. So these are some things that we've been kind of reviewing and seeing what our success rates are. There's also other areas. For example, treatment of kidney dysfunction. We have seen somewhere in the range of a dozen to 24 patients within the last few years, specifically for kidney dysfunction issues, that we have turned around. So they've been, I don't want to get too technical, but the specific parameters that we monitor for kidney function have been very low, and they've been to a point where they were basically heading down the tubes into eventual kidney failure. And we have turned many, many, many people around that were looking at that kind of future. All of it done naturally. These are just some of the things we're finding we're very successful at. And there's a whole range, obviously, of conditions that we have been treating because we're pretty broad in our practice in general, in our practice. However, we do have some serious, as we're seeing, core competencies that we're seeing a lot of success with. And these are just some of them. So natural medicine can work very well and be much, much less costly than the conventional approach. Yet, when people reflect on their costs, quite often they're thinking about insurance and covering their medical costs with insurance. And, you know, in some cases, they're not able to cover the cost of the natural approach. But they don't want to do the drugs. They don't want to use the drugs. They know about all the serious side effects of the drugs, and they want to avoid them. You know, there's a very large effort in terms of the conventional medical training to teach methods of gaining or retaining compliance with prescribed approaches. So in other words, people in conventional medicine are, I would say that's the same for my practice as well. I mean, natural medicine, I need compliance, and I need it to be understood that it's a partnership, you know. But the problem that is run into with conventional medicine is that there are so many side effects, quote unquote, There are effects of the drugs that cause life problems while addressing the original medical issue. They're causing other issues. And some of those are medical issues as well. So you get medical issues being addressed, and then the way that they're being addressed causes further medical issues. I mean, that works out so well for the pharmaceutical industry because they're gaining more and more and more business, obviously, from that. And again, these kinds of things are well documented, and you know, we have quite a system going here where the pharmaceutical industry makes huge profits, and you know, still, as we've seen with the EpiPen recently, they keep jacking up their prices, and you know, anyway, it's quite a racket. So looking at the natural approach, you know, if you're doing that or considering it, and you are having issues with the drugs you're taking, if you're taking drugs, if you've been prescribed drugs, first you should go to the physician who prescribed them and talk to them and tell them the side effects, quote unquote, that you're receiving, that you're experiencing, and ask them about their alternatives, right? You should also discuss the idea of changing and or coming off of those drugs, and what the best approach might be to do that, if that's what you want to do, or if there's no better alternative in conventional medicine. And then you can certainly address the idea of alternative approaches. Now, the majority of conventional physicians are not really that familiar with all the approaches taken in natural medicine. So they tend to be somewhat dismissive. However, a lot of the folks that are in the practice of medicine are somewhat more open-minded and do understand that there's a lot of benefit being gained from natural approaches, and are more perhaps integrative in their minds. And that's really where I'm coming from too, because I believe there are times when you need the drug. You know, if it's a life-threatening situation, typically those are acute situations, but even a life-threatening chronic condition could require a drug. That's more rare. But an acute condition where your life is literally being threatened by some health condition that's urgently needing care, aggressive treatment with conventional medicine may be the best option, and quite often is. However, simultaneously, there may be other options. And I say simultaneously because you may be able to work both methods together. If you're working with somebody who's open-minded enough to work with someone like myself, and I've done this with other physicians, you know, where they're prescribing a drug or two, but also we're doing natural things to deal with the issues that that patient may be having. So this is what we call integrative medicine. Okay. I respect what is being done conventionally. There are huge life-saving efforts that are involved in a lot of cases. There are, you know, very beneficial results in a lot of cases in terms of saving lives and improving life for individuals. However, in a lot of cases, the effects of the drugs can cause further medical problems. And this is a big problem. And some of the numbers that I've come across are anywhere from 100,000, which is really an old number, to 300,000 or more individuals in the US die from the treatment, die taking prescribed drugs as prescribed. That is a problem. And I guarantee you there's nowhere near that level of an issue with herbal medicine. Not even close. No, it may be a footnote once in a while, there may be an issue, but it's very, very, very rare comparatively. So natural medicine also has the benefit of being less likely to cause serious, quote unquote, side effects. All right, and I'm inclusive when I talk about natural medicine, I'm talking about Western herbal medicine, Eastern herbal medicine, and that includes several types: Tibetan, Chinese, Ayurvedic. There's many kinds of ways of approaching herbal medicine, and in the US there's even Native American approaches. So we have, and this goes throughout the world, there are native homegrown kinds of approaches using herbal medicine. Natural medicine is huge around the world, but in the US particularly, it's seen as kind of a fringe, but it's starting to be understood that that's not the case, that it's not really a fringe, that it can be used as a primary form or primary approach in the care of one's health. And that is starting to happen. We're seeing a trend in that direction, and it seems to be a growing trend. So my view is we all work together and we come up with the best solution for the patient. Another factor in this is quite often because most physicians, and I'm talking about primarily MDs, but in some cases even the DOs, although they tend to have a little more understanding of these issues, there is not a lot of understanding of natural medicine and what's done, what we do in approaching medical care. And so quite often when an individual has reached a point where conventional medicine can't do anything for them, they will hear the phrase, "There's nothing more we can do." Unfortunately, the next phrase should be, as far as I'm concerned, there may be some alternative approaches that you could use that could possibly turn things around for you. Again, what have you got to lose, right? You've got somebody who's being told by conventional medical people there's nothing more they can do. So if that is the case, you don't give up, right? Keep trying. There are other ways. So, and I, once in a while I get one of these situations where an individual comes to me who's, unfortunately gotten to a stage that's very difficult to treat. And um, you know, I often think, boy, I wish I had seen them sooner, right? Because there are a lot of things that I can do that natural medicine can do, that those of us who practice these natural approaches to medical treatment or, natural medicine treatment, holistic treatment, can use approaches that are often very effective, rather inexpensive, and because the difference in the approach is there. Okay, so why can that be the case? Well, because there is this huge difference in the approach. So part of the approach is, well, in conventional medicine, a large portion of it is about treating the symptoms. And so, if you can get a handle on the symptoms and improve the symptoms, that's considered successful treatment. However, the underlying cause of the disorder that leads to those symptoms may not be addressed. Quite often is not addressed. Whereas the focus of my practice and that of many people in the realm of natural and holistic medicine is to focus on the underlying cause. It certainly is in my practice. So when we do that, we see improvements, but they're not improvements because we're treating the symptoms. Although we may do that simultaneously just to, hasten or speed up the result. We're seeing huge results eventually, at least, because we are treating the underlying cause and addressing, for example, nutritional deficiencies, right? Quite often people are nutritionally deficient, and yet these things are not caught in the conventional approach quite often, in fact, very often. And so they fall through the cracks, and they don't understand why they're experiencing these signs and symptoms, but the treatments are there that treat the symptoms and address them for a while, and then they may have more symptoms, and then they come up with another drug to address those symptoms, and then they may have more symptoms and address these other symptoms and this kind of thing. So it's almost like a game of catch, or chase me, right? Little kid would play, they're playing chase me. They're chasing after these symptoms instead of quite often using those symptoms to direct them to the root cause. Now, I say it that way because there are other approaches as well, and we have this in common. We do diagnostic testing in my practice. We do blood work, and we will use imaging. We may use different kinds of imaging, but we use imaging as well. Certainly we use ultrasound and other techniques, MRI, but I prefer personally to stay away from X-ray until it's absolutely needed. And that includes X-radiation, or X-rays, CT, PET scans, things like that. Also, I prefer to use imaging that doesn't require nuclear medicine. Again, because of the effects of the nuclear medicine on an individual and the effects of the radiation on an individual. So we have a lot of approaches that we can take, and then there are tests that we do that conventional people don't typically do, like hair analysis or saliva testing, things like that. We also do biological testing. We may do a swab, a buccal swab, or something like that to get a sample to send off to a lab to get analyzed. So we do a lot of the things in common that conventional medicine as well does to determine what the underlying issues are. So to a certain extent, that's being approached. But I think the tendency is more for a focus on biological root causes, bacterial, viral, these kinds of things. And then, you know, in conventional medicine, there's a lot of the use of vaccination for dealing with viral issues. Well, in natural medicine, there are actually a lot of natural approaches to treatment of individuals who may have viruses, or treatment of individuals who may have bacterial infections, and so on. So, you know, it's not absolute that the conventional approach is the only approach. Absolutely not. There are many approaches. There are many, many systems of complete systems of medicine in the world. And in natural medicine, we tend to be using those systems to treat. So it is becoming recognized to the extent that there are enough people that are seeking this kind of approach that they can then join together, basically, by, in a cooperative fashion, coming up with coverages that cover these approaches. And so that is the topic we've been discussing really on the larger scale today, is about these approaches to coverage of natural medicine. So holistic natural approaches to treatment are now beginning to be covered by their own focused plans as an alternative to conventional insurance. So I'll give you a list of criteria for one of these insurance companies. Okay, or if we want to call it insurance, it may not be called that. It's more of a cooperative alliance. But we have natural medicine treating a diagnosis of a licensed provider. So it can be like an MD diagnosis and I treat, or I can diagnose and treat, or it can be a chiropractor sees somebody, says, oh, this is diagnosis I give you, you should go to Dr. Jackson and get some treatment with some acupuncture, for example, right? Or, you know, it may be more of an internal condition where we want to use herbal medicine to treat that condition. There's a lot of things we may do. They may show signs of rickets or some disorder that's caused by a nutritional deficiency, and then, you know, they may be referred to me to treat. So that includes the full range of practitioners. You know, I have referrals more and more regularly from MDs. Some even refer their own families. Some individuals who practice in conventional medicine come to me as patients. Actually, quite a few. So, you know, that kind of tells you something, but I'm not going to really go there. So treatments in the natural approach tend to be less invasive than conventional approaches for any given diagnosed condition. Natural treatment. This is all from a list on a brochure by one of the companies I'm talking about for a cooperative coverage of natural medicine. Natural treatment cost is less or no more than conventional for a given diagnosis. Okay, natural treatments prevent higher cost conventional medical treatment expense. That's one way to put it. Okay. Natural treatment plans are cooperatively based. In other words, it's a sort of a community way of looking at things, right? And it's cooperative. You know, my practice is part of that community, and my patients who come to see me to seek help for a condition using a natural approach are working with us. So it's more of a teamwork kind of atmosphere as opposed to, you know, doctor on high and you know, given your marching orders with the prescription and then go do this and see you in a couple of months or whatever, you know. It's a little different, you know, it's a teamwork effort. It's, you know, I'm giving somebody a treatment plan based on everything that I know to the point that I know it. And we take the steps and they're monitored as we go through that process of improvement. And I'm monitoring various factors that are involved in determining whether we're making improvement, whether we're seeing the improvements that I'm expecting or not. Usually, well, I won't go there, but it works quite well. And with the teamwork atmosphere, we have pretty good buy-in. You know, in other words, people are committed to seeing the results. They know that they prefer this option and they want to see it work, so they're going to work at their best. Hopefully, most individuals who seek this approach have that kind of an attitude. Okay, it is teamwork. It is somewhat based on individual responsibility, you know, each of us being, to an extent, responsible for our own health, you know, being aware of our bodies, being aware of what we're experiencing and what might be issues, and then doing something to address those issues. You know, seeking help. You come see me, I go through an intake, getting some history, getting a better understanding, maybe looking at previous lab work or diagnostic testing of various kinds, maybe some imagery, to understand what the ailments may be. They may be physiological or psychological in some cases. You know, but the psychological, when I'm talking about that, a lot of that may have to do with underlying physiological issues. So it's kind of a mix. And that's where this mind, body, spirit part comes in. You know, it's holistic, looking at the whole person, not just a part. You know, not just looking at their thyroid or just looking at their pancreas or just looking at their stomach. Looking at them as a whole person and looking at all of their signs and symptoms and using those as vectors to a good solution to getting to the root underlying causes of their issues. Again, from these brochures, let me see. Natural treatment plans, again, must be teamwork oriented, right? We have, it's a community. There may be many approaches that may be taken that can help an individual. So we're taking a look at some approaches that are not usually partaken in by conventional medical approaches or conventional medical teams. So basically the idea behind these plans is to cover an area of medicine that is not well understood by conventional insurance companies or conventional medical teams as well. But especially in this case, we're talking about the plans to cover this kind of treatment. Conventional plans don't cover natural medicine as thoroughly as we would like. There are many layers to it. And for example, if somebody's being treated for a disorder, there may be, when we get to the root cause, there may be several layers of underlying causes to the condition. In other words, there may be several factors that are involved to get to the root. And when a conventional insurance adjuster looks at, how things are being done, they may not understand the relationships of these approaches and what the need is. So then we get into all of these discussions and letters about medical necessity and all of this kind of thing. That just makes it more difficult to have people fully covered for natural approaches. And so this is part of what we're trying to address, and part of why I'm discussing this today is that, it's starting to be understood that this needs to be addressed more fully and for the benefit of our patients, and hopefully at a lower cost to the patient in general. But it's still in its infancy. It's still at a beginning stage right now. So, but we'll be discussing this issue and going into it more with some of the people who are involved in these plans and setting them up and running the companies that provide them, and then coordinating with the practitioners to be involved in these networks, we could say, that more fully address natural approaches to treatment of various disorders. So let's see, we'll look at one of the lists that is given by one of these companies. So natural medicine healthcare is kind of the topic, right? And they include acupuncture, which is a modality of Oriental medicine. It's one of the tools that is used in Oriental medicine. Chiropractic, kinesiology, herbal regimens, massage therapy, homeopathy, colonics, detoxification, Chinese medicine is thrown in there kind of as part of that. Chinese medicine, energy healing, getting into the fact that we are electromagnetic beings and working with energy. So that could include things like Reiki or medical Qigong. Intravenous vitamin C therapy, and this is one of the approaches to orthomolecular treatment, orthomolecular medicine, which was initiated. In fact, this specifically, intravenous vitamin C therapy, was introduced by Linus Pauling back in the late 60s, early 70s. And he was the father of orthomolecular medicine. We have other things like lab work, blood work, which is covered typically by conventional medicine or conventional insurance companies. But sometimes it becomes an issue because they want us to follow the protocol that's used in conventional medicine, and natural medicine doesn't work the same. We don't take the same approach because, we're actually looking for underlying issues that aren't found conventionally. And I can give you lots of examples, and I've done that some on the show. So that is covered. Even specific herbal treatments. SEACT is one that's used for cancer patients. And they're talking about covering that specifically. That's interesting. Biofeedback. Epigenetic testing. All of these kinds of things are included as part of the realm of what's covered by these plans. So that's quite a bit, and it's good to see it coming finally. Been waiting for a while, and I've even put some effort in myself to sort of pursuing it a little bit, but I'd rather see somebody else doing that, and I'd rather focus on my patients, and my practice. And speaking of, these approaches, one of the alternative imaging approaches that we use, that we take advantage of, is thermography. And that is one of the ones that is listed as being covered by these plans. There are a lot of them, actually. Food allergy testing, hormone testing, inflammation testing, all of these heavy metal testing, all of these kinds of things that we do in our holistic, natural medical approach are being or about to be covered by these plans. So this is good to see coming, and we'll be talking more about that. We're getting involved in the practice in these plans, and as soon as they're kicking in well and going well, we'll be letting everybody know about them. But I think I'm already doing that today. So, so that's pretty much a rundown on that. But we'll be talking more about one specific company involved in that next week on our next show. And I think it's a great thing that we're seeing this coming finally. So you've been listening to A Path to Wellness.
Doc, before you go, can we please remind people that we want to encourage people to start calling in.
Okay, so do you have that number?
Yes, we do, and that number is 727-873-7627.
Okay, so that's 727
873
873
7627.
7627.
And we will be posting on Facebook as well for next week.
Okay, so hopefully you heard that. We're going to be posting on Facebook as well. And so we'll take questions over the internet as well as
throughout the week. They can also submit some questions in. We're going to encourage that.
Excellent. So yeah, so we can take questions during the week as well that can be submitted to us. And then we can discuss those questions on the show next time.
And if at all possible, one of the thoughts, because we're going right now, it's Pink Month and all this about it's Cancer Awareness Month. If they have any and I just had in my family on a very personal level, somebody was diagnosed with breast cancer. So if in fact they have any questions, because people have a misconceived idea that the only solution immediately is to go to radiation.
Right.
So if they have any questions they would like to submit, so you could be able to address them, to please go to the Rhino on Air Facebook page
Okay, so to submit any questions you may have, and what Anne Marie was bringing up was that we're looking at breast cancer awareness this month, and that questions about that and
from an alternative medicine
different
standpoint,
approaches that might be taken aside from just chemo and radiation. Yeah, we can discuss those as well. So there you go. We have lots to talk about always. So feel free to communicate with us. Let's get that. Where should they send in those requests again?
They can go to the Rhino on Air Facebook page.
Rhino on Air Facebook page.
Which is facebook.com, Facebook/Rhino on Air. So it's a Rhino
/Rhino on Air.
Correct.
Okay.
So it's under the name, and they can either say
/Rhino on Air.
Yeah, but if they're on Facebook, they could just go to the Facebook page and either place it on the page or send a private message.
Okay.
They could also send you a message, and through the Rhino on Air website, you do have a Rhino on Air email address.
I never use,
but we're going to start using it now
okay.
because we are today is 10/16/16.
We're actually catching up with technology here, right?
Absolutely. Actually, we've been ahead of the game.
Okay.
Hopefully everybody else start catching up with us.
Including me.
So it's been great as usual, Doc, and I will leave it next to you.
Right. So you've been listening to A Path to Wellness on rhinoonair.com, and that is spelled RHINO just in case. So rhinoonair.com, and that's WSPF, and that stands for St. Pete, Florida. So WSPF-DB, and that stands for Digital Broadcasting.com. So WSPF-DB.com. If you'd like to get a hold of us at my practice, that is the number for that is 727-329-9637. Or if you'd like to take a look at our website, or even as well, look at the website. That's www.aptw.net, short for A Path to Wellness. So look forward to talking more about some of these issues next week, Thursday at